Hi everyone, my name is Igor Butorin, and today I'm speaking to American society, parents, government, and teenagers. Today I'm going to talk about one of the most popular and controversial topics related to health, vaping. Should teenage vaping be regulated tighter when in the near future? Let's have a look at the current situation with vaping and particularly teenage vaping in the United States. US survey says that about 20% or 5 million of high school students and 5% of middle school students have tried vaping at least once. Situation gets much more massive when we look into growth rates of vaping among teens. From 2017 to the end of 2019, the number of minors who has tried vaping devices has doubled according to national surveys. E-cigarettes are the most popular nicotine product, almost 3 times more popular than combustible cigarettes. Parents are not sure about the safety of vaping and are very worried about the health of their children. The Center for Disease Control and Prevention reports about 500 hospitalizations associated with vaping in 2019. Donald Trump states that something has to be done with vaping and it should be regulated much tighter. You can see on the map that few states in the US already proposed bans on vaping. Donald Trump banned almost all flavors of e-cigarettes across the nation in the beginning of 2020. Globally, we can see that more than 30 countries entirely banned e-cigarettes across the world. I have a clear position that we shouldn't restrict vaping that much, put such huge attention to it, and allocate that much funds. I'm going to introduce why I think so by analyzing in detail each argument that is presented on the slide. I suppose this point is crucial when we talk about restricting vaping. Firstly, there are other important health issues to allocate resources. Secondly, vaping generally doesn't really injure teens and can even help them. Thirdly, restricting vaping for teens means restricting vaping for all people, that is really bad for adults who are trying to quit smoking. Let's start with the first argument. There are other important health issues to allocate resources and attention. There are a lot of diseases in our world. Of course, we need to prevent all of them, find treatment. However, we always should prioritize because our resources are limited. Then we have a question, how to prioritize? By what factor? I think here the most suitable factor is the current death rate of disease and potential near future death rate. The problem is that society usually uses another irrational factor. It is a biased risk acceptance. Here I refer to the article written by James Hamblin, The Actual Harms of Vaping. We are afraid of diseases that are very close to us, or new diseases that nobody doesn't really know much about them, and less afraid of diseases that are far away, that are very far away. For example, they can be in our countries, in our districts of our country, were just rare and we don't hear about them a lot, or they are very old and we got used to them. Here, for example, I will compare diseases from smoking and diseases from teenage vaping. People accustomed to smoking and forgot about huge risk of it for smokers, and we need to help them a lot. Vaping is something new, something unknown. This makes it very dangerous in the people's eyes. Moreover, when we talk about teenage vaping, here parents turn on their parental instinct and their risk acceptance escalates even more. That's why parents become very afraid of vaping and want to restrict it. However, it's irrational for the whole society. Only 49 people died from vaping in the US by November 2019. Every year, imagine, almost 500,000 people die from smoking. I think it's obvious that smoking is far more important for our society. There are also other important diseases. You can see the phrase on the slide. Alcohol-related diseases, all types of flu. That's why we need to concentrate on and allocate funds on more important health problems and diseases than vaping. Putting a huge attention to such small problem for now is ridiculous in my opinion. Second argument. Vaping in most cases doesn't really injure teens and can even help. University of Michigan in its research found that combustible cigarettes use among teenagers is decreasing in the past 10 years due to the growing popularity of vaping. You can observe the chart. More restriction on vaping will lead to increasing number of smokers among teens. Nearly all researchers agree that vaping Nicotine is better than smoking cigarettes. Likewise, Michael Pesco's research found that the majority of teens doesn't really consume the most dangerous substances of vaping, nicotine, marijuana, or other drugs. We need to focus on those teens who really have addiction and need help. And the third argument. Restricting vaping for teens means restricting vaping for all people. Donald Trump banned almost all flavors across the nation in the beginning of 2020 because of spread of teenage vaping. Flavors are the key elements of vaping process for those who want to quit smoking. Also, almost all techniques except vaping are not pleasurable for smokers. Appealing flavors have helped the vaping industry to flourish and help a lot of people to quit smoking. Even Public Health England are currently opening up vaping shops in their hospitals because of such therapy really helps people. More than 10 million adults vape regularly in the United States because they need to quit smoking. In that case, I suppose regulating vaping tighter because of teenagers leads to much more adult deaths from smoking. Based on these three arguments, I think we shouldn't restrict vaping that much and put a huge attention and allocate high amount of funds on it. Likewise, here I need to put a little disclaimer. Nevertheless, vaping nicotine is 100% dangerous for teenage health. Vaping leads teens to diseases that influence lungs, brain, nervous system, blood system, heart, and of course, vaping, like smoking, is very bad for people who passively consume vapors. Thank you for your attention.